time. Thank you all for joining our first of our webinar series. I'm super excited about this. My name is Tina Sadat, and I am your Georgia Chapter Executive Director. We're excited to be able to provide our members and hopefully future members our Platinum webinar series. Over the next couple of weeks, there are 5 webinars, all featuring proven and trusted experts from various industries. You will have the opportunity to hear from our Platinum precious metal sponsors on various topics. These are all to take place on Tuesdays and Thursdays from 11:30 to 12:30, and registration is open on our website. And most of you know that. It's www.cai-georgia.org. We continue to encourage you to reach out to us with the questions you are facing on a day-to-day basis with your clients and community, so we can help you navigate through these unprecedented times as we are all in this together. CAI-Georgia sends out an electronic newsletter to our members with frequently asked questions, as well as a blog located on our homepage. We also have information on joining CAI on our website for those of you who may not be members yet. Today's webinar is about how to open amenities safely and effectively, includes 5 of our precious metal sponsors. It is my pleasure to introduce Kevin Kushel, an attorney with Coulter & Sierra, Dale Prendergraf, owner of P3 Painting and Renovations, Kelly Moon with Epic, a remediation company and also a current board of director, Mike Dangler with Russell Landscape Group and also the VP on the CAI board of directors, and lastly, Clay Collins from Brown & Brown Insurance of Georgia. We have received questions from membership that we presented to our panelists in advance. They will have approximately 10 minutes to answer the question, and we will allow some time at the end for Q&A for you. You may do this by typing in the Q&A option you have available to you on your screen. We encourage you to send the questions at any time during the presentation. If you have a particular panelist you wish to direct your question to, please indicate that in your question. We will do our best to answer as many as possible, and we'll provide the contact information of all of our panelists at the end. So let's take a look at this survey. This is awesome. We've stopped it. And let me share the results with you. Oh, somebody doesn't know what day of the month that is. So 45% of you, when we asked you how you're doing, said you're great and you're adjusting to the new normal. 35% said hanging in there, just taking it day by day. And then we've had some others here that have struggled. And this is all anonymous, so we can't see who voted. Have most of your communities open their amenities? Predominantly no. We have 50% of you that took the poll saying no, you have not opened. That's interesting, okay. Overall, how do you think your community HOA board is doing? Most of you, 65% of you, said we have had some ups and downs, but we're figuring it out. And fortunately, only 5% or 1 person voted that awful, they've all resigned. And I'm so sorry for that if that's the case. So let's go ahead and get started. Our first panelist is Kevin Kushel, an attorney with Coulter & Sierra. Kevin, tell us about you and your law firm.
Hi, Tina. Thanks, everyone. Good morning. Again, my name is Kevin Kushel. I'm an attorney with Coulter & Sierra. I've been with the firm for a little over 5 years. My practice is generally focused on general services, so I handle pretty much everything for a community association except collections. I do a little bit of that, but it's more to assist some of the other attorneys in my office. So my primary focus is dealing with everything else that can come up for a community association. So contracts, covenant enforcement, amendment drafting, things of that nature. So kind of segues good into this question because I've been dealing with this COVID stuff, as everyone can imagine, a lot over the past couple months. I don't know if you want to let me know the specific question, but I know it's about opening the pools and things like that.
Sure. So we obviously, our attorneys are very busy these days, but one of the questions that keeps coming from our membership, and I would like to ask you this, are what are the legal responsibilities does an HOA board have to their communities when it comes to opening the amenities?
Okay. Like any issue that can come up for a community association, the board's responsibility is going to be to do what's in the best interest of the association. In this case, we're all sort of dealing with uncharted territory. You know, COVID-19 is a new thing. Even with past pandemics, they haven't been, you know, they haven't been as readily around and prevalent as this has been. So, you know, this is certainly new for everyone, not just attorneys, but certainly everyone in the industry. As a lot of people know by now, there have been lots of guidelines that have been put out by the state of Georgia, the CDC, and really what the board's responsibility is to do is to follow those guidelines as best they can to protect and prevent the spread of this disease. So it's going to be easier for some associations than for others because not every amenity for every community is the same. So you have small communities that have a small bathroom pool cabana and a pool, and that's it. And then you have others that have large clubhouses, tennis courts, playgrounds, pools, you know, tons of stuff. So for the latter associations, there's going to be a lot more to do in this situation than the smaller communities that might just have a small pool and a, you know, little cabana area. So what we've been telling everyone generally is that, you know, based on Governor Kemp's recent orders, based on the CDC guidelines, there are really a few major things that each association needs to do if it's going to open the pools and other amenities. And that's enhanced sanitation, enforcing social distancing, and putting up proper signage around the amenities to let everyone know that they're coming in at their own risk, that there's a potential for, you know, COVID being present. There are also other signs and guidelines from the CDC about proper hand washing, how to wear masks, things like that. So really, I saw from the poll that about half the communities haven't opened the amenities, and maybe they aren't going to open right now. And what that's stemming from is the insurance issue. And I don't want to ruin any surprises for Clay later on in the presentation, but really what we're figuring out is that there's probably not going to be insurance coverage for a COVID-19 related incident at your association. So really what boards have to weigh is they have to weigh, can they implement these guidelines? And if they can, is it worth doing it in the face of not having insurance coverage? Because what's going to happen is, even though it's probably going to be very difficult for someone to prove that they got sick at the amenities, it still may not stop them from suing the association. And the association, again, may have a good case, a good defense. It may be implementing all these guidelines, but it's still going to have to come out of pocket to defend the lawsuit. And so that's essentially what boards are weighing right now. And I certainly understand. I've been cooped up in my house for a couple months now. My wife's pregnant, so I've been extra careful. So, you know, I get it. You know, in March, it wasn't very difficult to kind of stay inside, but now, you know, the weather's nicer and pools are opening and people want to get out. So I certainly understand the frustrations in a lot of communities. But again, the board has to make the decision that's in the best interest of the association, and that may not always be the most popular decision. And if it can't implement these guidelines that have been put out, or it's going to be too expensive and not feasible to do some of these things, a lot of boards are just deciding, let's keep it closed, let's see how things go. No one wants to be the guinea pig as far as an illness or something in their community. So, you know, there are a lot of communities that are being cautious about it. And again, without having insurance, in my opinion, that's a smart decision. That's the best way to mitigate risk and potential loss in this situation. You know, without insurance, it's risky. But again, you know, if associations are confident, they can, you know, do the enhanced cleaning, enforce the social distancing, put up proper signage. It is possible to mitigate as much risk as possible. It's not going to eliminate all risk, but if associations can do those things, they're going to be in the best position to defend themselves in the event that there is some sort of claim or lawsuit against them. Some other suggestions that I've been giving some of my clients as far as, you know, social distancing and enhanced cleaning, ways that they can do this is, you know, specifically for a pool, some associations are not putting out their pool furniture because a lot of the guidelines and the governor's orders are requiring enhanced cleaning. So if you take away the high touch surface areas, the pool furniture, and ask people to bring their own chairs and their own furniture into the pool. That's one way an association can mitigate, the high touch items at the amenity area. Another thing is to implement some sort of reservation system where if your pool normally has a max capacity of 50, maybe the association decides to limit that to 25 now. And that'll help, keep social distancing in place. It'll, help with conflicts between people just showing up all at once on a nice day. And again, a lot of associations can do that pretty easily through apps or email or things like that without actually having a physical sign-up sheet where everyone's touching a pin at the clubhouse or something like that. So there are lots of ways that each association can be creative about it. But the underlying takeaway is that associations need to do these things if they're going to open. Even if the governor's order expires on the 15th, which I'm not entirely sure what's going to happen now with all the protests and talking about second waves. So we're certainly going to keep an eye on that. But even if that goes away, COVID certainly is still present. And so I think associations are still going to be obligated to carry out these measures and to ensure that the communities are doing enhanced cleaning and enforcing social distancing, because again, if they decide to open in the face of not having insurance coverage, it's going to be very risky for a lot of communities. So again, some associations are deciding to open, some are staying closed, some are waiting. Again, I've had a lot of questions asking me, do we open, do we close? And I can't speak for other attorneys, but I'm not going to tell one association to open or not open, but I'm going to give them these guidelines and I'm going to help them, talk through what their particular situation is, and so the board can make the best business decision on behalf of its association. There have been a couple new developments, and I expect this to be fluid over the course of the summer as we learn more about COVID-19. But just in the last few days, I've had a couple questions. One about if the association finds out that someone in the community actually got COVID, and perhaps they were at the amenities, earlier before they found out, what can the association do? And I think at that point, the association may have an obligation to close down the amenities, do the enhanced cleaning, wait it out before it decides to reopen, if it decides to reopen. Certainly there's been some debate about notifying the association about the illness, or telling everyone that, hey, we have a case in the community. And I think associations need to be careful about what information they disclose about someone if they find out. But certainly talk to your association attorney if you do have a case in your community to sort of get the ins and outs of what happened and what's the best way to communicate, and perhaps even having a candid conversation with the person who tested positive to see if they're okay with disclosing certain information or want to be a part of letting their neighbors know that they tested positive at some point. One last issue that also came up recently that I think we're going to continue to see over the course of the summer is someone that claims they have a disability and they're seeking a reasonable accommodation because maybe the association took away all the pool furniture to, counter that high touch area or those high touch surfaces in the pool amenities. And again, I think it's going to be a case by case basis, but if there's, some way the association can set out maybe a reduced or limited number of, items of furniture, or allow certain homeowners to store furniture, a chair or something in the cabana area or a storage room so they don't have to lug it if it's an elderly person or someone that, has some other type of disability. I think a lot of those issues are going to be more frequent. We're going to hear more about them as the summer continues and, more and more pools open. Again, we're learning kind of at the same time as all this is going on, and again, trying to figure out the best way to tackle issues and the best way to mitigate risk and ultimately, prevent the association from having to deal with a claim in the face of not having insurance.
Yeah, it's definitely a new normal for sure, and that's really great information, Kevin. Thank you so much. We're going to move on to our next panelist. And I'm waiting for him to pop up on the screen. Great. Our next panelist is Dale Pendergraft. He's the owner of P3 Painting and Renovations. Dale, tell us about you and your company.
All right, so I'm the owner of P3 Painting and Renovations. We do We're a paint contractor. We operate as a general contractor. We handle all types of repairs and maintenance for the exterior and interior of HOAs. HOAs are our clients. We don't really deviate into residential or anything. This is what we've done since 2008. So we started this business in 2008, which is very similar to now because we were kind of in a recession then, and now we're kind of, you know, almost in a semi-recession, waiting to see what happens here now. So you can go ahead with your question.
Great, thanks for joining us. So the question from membership is, should communities move forward with their current construction projects, and what should we be asking our contractors to ensure community safety?
Okay, so, well, that's a loaded question. Some of that, whether they should move forward or not, I think they might need legal advice on that. But as far as our operations go, we've been open for business, and we haven't slowed. We slowed a little bit. We haven't stopped doing business. We've had to change the way that we do business, but in the last couple of months, we've received in over 151 projects. They range anywhere from $500 to $300,000. So people are still doing business, but the way we do business has significantly changed. Construction is considered a Category 3 business, which was allowed and still is allowed to operate in full. And what we've done on our side is change the way that we do business. And some of the projects that we've elected not to do are interior projects.
Mm-hmm.
And any projects in occupied spaces primarily are the ones that we haven't done. We have done some clubhouses and amenity projects that were interior and exterior, but they weren't occupied. So, and then of course, at the end of that, it ends with a good cleaning of all the surfaces when you're done.
Sure.
So, now, some of the projects that we're doing are very broad. And I know it was an amenity topic, but you asked me a broad question, so I'll make sure I'm not off topic here. But are we talking about community-wide or just amenity only?
I think we're talking both. I think our audience would like to hear both sides of that.
So the projects that other people are doing are very broad. I mean, they're doing deck projects, they're doing painting projects, we're doing wood repairs, we're doing concrete work. You know, you have trip hazards and things like that. People are addressing all of those issues. We've done stucco work, fence work, just about everything, amenity work as well. So we haven't really slowed down. It seems like, you know, we have stayed busy the full, you know, this whole time. So it's been very good. You know, some of the things that we put in place are in the office. We actually have had everyone recently tested for COVID. 100% of the employees were tested. And at the beginning, back in, I think, around March 15th, we moved everybody remotely. So everyone went remotely except for 3 or 4 people, which I was one of those people that still came into the office. But all the project managers and all the salespeople went remote. So we secluded everybody so there wouldn't be, if anybody did get sick, we wouldn't cross-contaminate each other.
Mm-hmm.
We had a small group in the office, which was accounting and myself. Now we've, you know, put practices in place with hand washing stations and things that everybody else has done as well. Quarantine policies, if they were to get quarantined or get sick, we quarantine them for 2 weeks and they have to get tested before they come back. And that's worked out really well. Travel policies, and then on the job sites, you know, gloves, masks, check their temperatures, keep them 6 feet apart. Hand wash stations, make sure the porta-johns are kept clean and wiped down. You know, we're careful not to paint doors anywhere we have to interact with the homeowners. We're staying away from doors, and windows are kind of tricky, you know, but we're able to do those and wipe them down without the homeowners having to be present. And that's pretty much most of our procedures that we put in place.
That's fantastic, Dale. It sounds like P3 is doing everything right. That's perfect. I do have a question from one of the panelists. I'm going to go ahead and direct this to you because it's about paint. And this is from Bill. Is there any paint we can use on the pool deck to define social distancing that we can remove easily when the season's over?
There is no paint you can put on a pool deck that will remove easily. I
Easily.
mean,
Okay.
it should be cleanable. You should be able to clean your painted surfaces.
Okay.
But once you put paint on a pool deck or something like that, removing it, it's almost, you know, it's a chore.
Yeah. Okay, good to know. I know there's some decals and things like that that you can put down, but thank you for that. Wonderful. Would you like to add anything else, Dale?
I think I'm good. I'll wait for the question and answer section.
Okay. Thank you so much for joining us today. I appreciate it. We're going to ask Kelly Moon to join us. Hi, Kelly. Okay, Kelly is with Epic. It's a remediation company. So Kelly, tell us all about you and Epic.
Good morning, everybody. Again, I'm Kelly Moon with Epic. We are a full-service property remediation company. So basically anything you don't want to happen at your property, such as fire, flood, the nasty moldwort, that's where we come in and handle.
Excellent. So membership has asked, what is the safest way to clean, sanitize, disinfect amenities, and what areas should they focus on and how often?
Wow, that's like a three-part question.
Yeah.
It's a great question, though, and certainly one I think that has been weighing on a lot of people's minds, how to handle this situation and what they need to do. First of all, we have to look at cleaning a lot differently than we did before. And during this time and future times, and we don't know what the future will hold, it's important to clean and clean correctly. First of all, there's a big difference between cleaning and disinfecting. Cleaning, simply put, is to remove grime and dirt, and disinfecting is to kill germs. So how you do that is very, very important. There are simple but safe and effective ways to do that. And just to give you a few pointers and tips through this that you can share with your staff, make sure that your janitorial companies are doing, is that you first clean and then you disinfect. When you clean, you can use warm water. You can use degreasers, a branded cleaner, and you spray it on. And then this is very, very important. You make sure that it is wiped off immediately with a microfiber cloth in an S pattern. That is crucial. People are like, you know, why is that important? But, and I will tell you in just a minute, after you wipe that cleaner off, then you spray your disinfectant. And for all you impatient people, such as I am, you need to let that dwell for about 5 minutes, at least 5 minutes. And if you have a little more patience than I do, then 6, 7 minutes is even better. Giving it time to work. It needs to work. It needs to do its job. After it dwells, again, using microfiber cloth, not cotton, and using the S pattern, you wipe it down. Contrary to the belief, the circular motion, it just basically wipes germs and bacteria around. So save that motion for waxing a car, not for cleaning. The microfiber cloth is, there's no shame in asking your companies that you use or your staff, is this what they use, microfiber cloth, because it is very important. It can trap bacteria by utilizing static electricity, and it can pick up like 95% of bacteria. And that's huge. Where a cotton cloth, yeah, it will basically spread it around. So each strand of that cloth is equipped to capture like the smallest of particles and germs. So very important. As far as the primary focus, and that should be your high traffic areas and their touch points. And I think we all pretty much know what they are, especially in a lot of these high rises that have elevators and mail rooms and your door handles. Those need to be wiped down, and how you do it is very, very important. So again, you know, there's no shame in making sure that your janitorial company and your staff are handling it correctly. The disinfectants, again, they need to be CDC certified. So there's different things you can also do, like making sure if you don't have to close a door, leave it open. You know, there's little things, there's little tricks. I don't know how many of you are familiar with the COVID key. It's a great tool, and I actually have one here. And it's something that you can put your finger to. You open a door, pull it open.
Oh.
So it's very useful. The end of it is used as a stylus and can hit elevators. Encourage people to buy them. You can buy them online. They're not that expensive. Make sure your staff has that. It's very helpful from spreading germs. So as far as the cleaning and how often you have to do it, let's think about it this way. When people leave out in the morning, they're showered, they're clean clothes. So you want to make sure that they leave out clean. Everything else is clean. So do your deep cleaning in the evening. That's after they come in from work, from the grocery store, from Uber, however, you know, wherever they've been, Target. There's no telling what germs are coming in. So deep cleaning should be done in the evenings. Then the next morning, everybody's leaving out fresh and clean. Your property will be clean. Then make sure that, and it's just not realistic to, when you're at a property, to wipe down after everyone. You know, they walk through, you can't just be spraying behind them. It's not realistic.
Right.
But do it as often as you can, but definitely say mid-morning and mid-afternoon. Just do a nice wipe down, disinfect, and make sure that the property, you want to make sure that you have a healthy work and living environment.
Excellent. Thank you, Kelly. I learned something there. I'm going to go back through and probably clean my house again.
Yeah, we unfortunately here we have little meters that will tell you how clean things are, and it's no fun to take that home. So you realize what's really out there. And just so you know, if there is, you know, your property, if there's a property out there that is wanting us to come in and properly train your staff, we are happy to do it.
Oh, excellent. So Epic provides training as well.
Yes,
That's wonderful.
Yes, we'd be happy to come in and train your staff. You just, if you contact me, that's something I can set up.
Excellent. Thank you, Kelly.
Thank you.
Our next panelist is Mike Dangler with Russell Landscape Group. Mike, tell us about Russell Landscape Group and what you do there.
Russell Landscape is full service landscape maintenance. We're about 50% HOA and 50% commercial. Located 3 branches in Atlanta, 1 in Destin, where we do all of Sandestin, Tampa, Savannah, Charleston, and Nashville.
Oh, awesome. So your question is actually a 2-part question that came from membership, and it's a bit long, so bear with me here. As more and more people are out there about in Georgia, opening more and more businesses, have you had to change your standard operating procedures to ensure the safety of communities and your crews? And also, what types of projects are you currently working on for the communities?
Oh, good questions. As far as safety and policy and procedures, we were listed as an essential service from day one. So that had its benefits and it had its downfalls also. So it was really important that we looked internally and had to keep the safety of our crews in line, just to make sure, because of the domino effect that could hit our crews, which could wipe out a branch in no time if something like this hit. One of the first things we did was go to a staggered work time, where we set up crews coming in 15 minutes apart. And we had 5 to 6 of those at first. Now that things have changed, we've narrowed that down to 3, where we start at 6 o'clock, 6:15, and 6:30. Different things that we've set up for the crews. When more than one employee is in a vehicle at a time, it's mandatory that all of them wear masks. We've provided more of a lightweight style mask that is a lot easier for them in the heat to wear. But another thing we've done is, whenever they're stopped to fuel, that was a big time for guys to go in and eat lunch and different things. And now it's a strict policy that only one employee can go inside at a time, and they must wash their hands before they leave, just to keep everybody clean.
Mm-hmm.
Another thing is, if you've ever seen a landscape company, the end of the day looks like organized chaos. It's guys sharpening blades, getting their equipment ready, and washing trucks. Well, now we went to a policy of the foreman drops everybody off in the parking lot, then he alone gets everything ready. So you just have one foreman for every truck. So just trying to keep that separation. And where that's taken us, I'll give you an example. At one of our Sugarloaf office, we had a crewman, or he was a foreman that tested. He came in April 31st. That was a Thursday, saying he didn't feel very well. So we said, definitely take tomorrow off and get tested. Well, we looked at who he rides to work with and who's on his crew, and that quickly dropped down to 10 individuals, 2 5-man trucks.
Wow.
And he came in tested positive on Monday. So we put all 10 individuals in quarantine. They get paid during that whole time. But if you look at 10 individuals working a 40-hour work week for 2 weeks, all of a sudden you have 80 hours that you've got to provide for your customers to get that. And so it puts a lot of stress on quality, and it puts a lot of stress on the rest of your manpower to make sure that you can get out there and do it. Everybody else is on time and a half. So to give you an idea, with our labor, those 10 guys, that's about $15,000 in 2 weeks.
Yeah.
But then what we had to do is time and a half, overtime to get that done. And you're looking at all of a sudden, for that same billing of maintenance, $36,000 in labor that it's taking to get that done. And for us, I know a lot of property managers talk about pool season being the time of the year that is toughest on them. For landscapers, April, May is murder, and those are the 2 months that you're just struggling to get everything done. If you can make it to the summer, you're in cruise control. So this hit us as a very, very hard time.
Sure.
But it's nice that now things are getting in good shape. I'm glad to report that the foreman, we made him go through 3 tests of negative tests before he came back to work, and he came back to work Monday. So he was gone 6 weeks in total before we could trust him to be around other workers and be back around on our customers' properties.
That's really comforting to know, Mike, that if I'm doing business with Russell Landscape, you're taking every precaution. So it makes me feel much better, or referring my customers as a property manager to you, knowing that we're going to be safe when we hire you, which is awesome.
That's good to hear. And I guess the other question was on projects.
Yes. What types of projects are you currently working on for communities?
Things have changed drastically. Communities, I sold a job that I was working on all winter. And when I first met with them,
Mm-hmm.
they were most excited, and why they hired us was our ability to, it's an older community, and they had multiple entrances, and they wanted every one of their entrances re-landscaped. And my first statement was, a mistake people make is they just go with the idea of the funds they have now instead of doing it completely. So get a plan to do everything. And they came back and said, we've got the funds. We want to do it all now. Mm-hmm. Basically a $120,000 budget to re-landscape these entrances. By the time everything got said and it was May the 1st to go, that 120 dropped to a $20,000 because they were nervous about where they're going to go. So it's making a change. We also realized that our managers aren't, we're not able to get face-to-face time right now with them as much. So what we've really instituted, Brandon Thomas, our vice president, is kind of heading this up, is a program of doing site audits on every property where we're taking pictures, talking about what we can do, and looking to the future. If the neighborhoods are nervous now, we're really setting up a program where we're ready to go to managers for 2021 and say, these are the projects we would suggest you budget for. So you can look forward, trying to look into next year. If they can't do it now, let's look then. And that's a big change for us. one of our clients that we've worked closely with that has really helped us during this time, and we're proud to say we've helped them, is Pruitt Healthcare. We do all the Pruitt Healthcares across the Southeast, and everybody, I'm sure you've seen them on the news. Those are retirement homes, and because they've been in the news so much in their different markets, they want their properties to look as good as possible and ready there for the media to come in, and they will contact us on, say, a Wednesday saying Friday we're going to have press conferences here, and we call a code red, and a branch will almost shut down sending crews there to make sure they look their best during that time. So we're there for them. So it's thinking out of the box, trying to do different type of projects, and then looking towards the future, letting our customers know we're here for your planning for that.
That's fabulous. Thank you so much, Mike. That was great information.
Thanks.
Ask Clay to join us. Awesome.
Good morning.
Good morning. So our last panelist is Clay Collins with Brown & Brown Insurance. So Clay, tell us about you and your company.
Well, I'll try and make this short. I have been with Brown & Brown my entire career, 24 years. We are the 6th largest insurance broker in the world. We employ just over 10,000 employees. We're a publicly traded company, and we are, for either the second or third year in a row, we were listed as the largest insurance brokerage in Metro Atlanta by the Atlanta Business Chronicle. So here in Atlanta, through multiple subsidiaries that we operate, we have just under 1,000 employees. So within that footprint, we also have what we call our Community Association Division that was founded back in 1980 by Sally Butler. We were fortunate to acquire Sally's firm, Insurance Marketing Group, back in 2004, and Sally has been a staple in the CAI and in the community association community for a very long time. And unfortunately for me, because she's a very close personal friend of mine, she retired in 2019 and moved to the beach. So with that, we continue to operate and to work very closely with the 1,500 plus communities that we insure here in Atlanta alone. So we appreciate all the support out there. So with that, I'll turn it back over to Tina to pose the ever so popular insurance questions.
Excellent. Insurance. This seems to be the big topic of conversation, and we know you've been busy fielding a lot of questions. What types of questions have you been receiving in regards to opening amenities?
Great. Well, the first question that we always get is, if we open a pool in particular, or amenities in general during a pandemic, how does that impact our insurance, our potential insurance? I think Kevin touched on it briefly during his comments. And we have two areas of insurance that everyone needs to keep in mind. You have your general liability insurance, which covers the association for claims from third parties brought against you for bodily injury, sickness, disease, or death.
Yep.
So the general liability is there to protect you. Okay, so if something happens and somebody accuses us of acquiring or contracting COVID-19 or any virus on our premises. And so what we have concerns about, and we know that there's mixed messages coming out from multiple brokers or multiple insurance companies, but from the legal community that I've spoken with and that our firm has spoken with, we're concerned about three particular exclusions in the policy. The first are pretty cut and dry. Many policies have a communicable disease exclusion, so that is what it is. It's going to be excluded for communicable disease. The other one is virus and bacteria exclusions. So again, those are fairly clear exclusions under many general liability policies. The third one is not as clear, and the third is expected or intended injury. And so what we are concerned about from the insurance community is how insurance companies will define the standard for what is expected or intended injury. Obviously, the CDC and other clinical data has proven that COVID-19 is a highly contagious virus. Mm-hmm. So opening our amenities during a pandemic, when it's considered highly contagious, would that be considered an intentional act or an intended consequence? So that particular exclusion is on every general liability policy out there, unless there's some unknown policy that I have not come in contact with. But again, those are the three that we're most concerned about from a general liability perspective. Then we have the directors and officers liability, which is there to protect you, the officers, the directors, your volunteers, your committee members, so on and so forth, from wrongful acts and decisions that you may or may not make on behalf of the association. So I'll talk a little bit about the D&O impact through some other questions that are obviously brought up. And one question is, if my association is being sued because the board refuses to open our amenities, do we have coverage? And it's a great question. And the answer is, yes, we do believe that you will have defense coverage and potentially indemnification under the D&O policy, because that would be considered a breach of fiduciary duty, which is covered under the D&O. So if you as a board decide you're not going to open the amenities and you're sued for that decision not to open the amenities, you need, and if you're sued, file that claim. We believe that there should be coverage under most D&O policies. But again, like attorneys, we have to give every disclaimer that every situation is different. So you need to have this conversation with your insurance broker and your attorney, but we do believe the D&O policy will respond to that particular claim. What happens if an association member brings a breach of contract lawsuit against the board, alleging that the association did not perform its duties in collecting assessments from members who failed to pay assessments during COVID-19 because of a financial hardship? This is even more complicated situation, and something that many associations are dealing with now, because they have an obligation to meet fiduciary responsibilities and financial responsibilities for the association. And if we're failing, or if the board is failing to collect those assessments, then are they opening themselves up for a breach of contract claim with the association and its members? So breach of contract, believe it or not, is normally excluded under the D&O policy. But what we believe would happen in this particular case is that there would be additional claims associated with that particular breach of contract claim that would trigger defense coverage. It may not trigger indemnification for the board for the breach of contract, but most likely it will trigger a breach of fiduciary action of some level that would trigger defense.
Sure.
So what happens when residents of a community begin making demands for refunds and offsets from assessments and fees because you failed to provide me access to my amenities that I'm paying for every month? So again, under the directors and officers liability, we believe that this would be an alleged breach of fiduciary duty, and we do believe that this would be covered and defended under the D&O policy. So then, last but not least, should my association open our amenities now? We get this question every day, at least a dozen times a day. And we, like Kevin, we cannot answer that question directly. We have to just give you the advice of what to consider and what risks you be taking in opening your amenities. But here are a few things you need to consider. You need to review your governing documents. Obviously, your documents state whether or not the board has the right to control access and utilization to your amenities. So let's make sure, first of all, that it does have that language in your documents. And then, if so, do current federal, state, and local directives regarding COVID-19, how do those impact your board decisions? Well, you need to consider the size of your facilities. You need to consider the costs of cleaning and sanitizing your facilities and providing the necessary sanitation equipment and materials, and the cost of potentially have to monitor those amenities to enforce social distancing. So there's a huge financial component with opening the amenities that every board needs to take into consideration. And then the question is, does the association have the available funds to meet those financial requirements for sanitation? But also, does the association have the available funds to potentially self-insure or defend an uninsured claim? If it's uninsured under the general liability policy, if it's uninsured under the D&O policy for defense, because remember, directors and officers liability excludes bodily injury, sickness, death, and disease. So if you're being sued for those 4 items, that has to fall under the general liability. And if you have an exclusion, which we anticipate there will be, then is the association prepared to defend and pay for their own lawsuit. So those are the things from an insurance perspective.
Okay.
Tina, I know I went really fast, but if you have
It's a big
any
time.
follow-up questions, I'm happy to answer.
With a lot of questions. I'd like to invite all the panelists back. At this time, we have a Q&A session. And during this Q&A session, I'm going to go ahead and put up their contact information for those of you that are viewing, so you have that. And we will start. I have several questions here that came in, so I appreciate you guys and your presentations today. The first one is about inspections. This may be directed to Kevin. A lot of communities are waiting on inspections to open their amenities. Is there a delay in this process that is causing the delay in opening the amenities?
My understanding is that it's going to vary from jurisdiction to jurisdiction. So, some counties have delayed their inspections and haven't been able to do them for, a variety of different reasons, and some counties have been able to move forward with them. So it's really just going to depend where your community is located, and if you're not allowed to open because you haven't had an inspection yet, then it's an easy decision for the board to communicate to the members, because that's, they can hang their hat on that and basically say it's not their fault yet. We're still weighing the options, but until we have this inspection, we absolutely can't open. So it kicks the can a little further down the road, but at some point, if they do get the inspections going up for your particular jurisdiction, you're still going to be faced with that question as to whether to open or not. And like Clay just discussed, there's a lot of things to consider.
Sure, thank you. This one is directed toward Kelly. Some folks have commented that they don't have professional cleaning services, and it was recommended that you do it at close of business or in the evening, and that's just not a possibility. So what is your recommendation for maybe self-managed communities that just have a cleaning crew coming in? Just increase the cleaning times, or just if you get that second cleaning in, it may not be at closing time, but it's in. What is your recommendation behind that?
Yeah, and it's it's definitely not feasible for everyone at certain times. But yeah, you definitely want to just get it in as often as you can, and the main thing is doing it properly.
Mm-hmm.
Again, just to reiterate, microfiber cloth is very, very important, and also the disinfectants, cleaning and disinfectants, and make sure that disinfectant dwells. It's really tough because I wish that you could say it's that easy to just go in and wipe it down and it's done, but if you do it frequently enough, it's just make sure you go and take care of those high traffic touch points.
Okay, great. This is directed towards Clay. We are a self-managed community. If we were to hire a management company, does that reduce our liability?
It doesn't reduce your liability. Again, you as a self-managed community, you are still the first named insured under the policy. So again, you are ultimately responsible for the actions and liability associated with your community. So it does not necessarily, it might reduce and mitigate your risk, because they would bring in additional services that you're not providing now, but it doesn't reduce your liability from an insurance perspective.
Okay, thank you for that. Dale, for construction projects, have you had to reduce the number of workers on site, and has that caused any delays?
So at this time, with the main restriction working outside being that we're 6 feet apart and we're not interacting with owners, we have not had to reduce any people on site. So we've been very lucky from that respect.
Okay, awesome. Let's see, I had one more here from Mike Dangler. Interesting, Carol writes, people are spending way more time outside. What plants can you recommend to keep mosquitoes away?
That's not an easy one. Can't really recommend any plants. I mean, the services that I have seen have really, as far as spraying for mosquitoes, are the best bet, if that's something that you're comfortable with.
Okay, great. Do we have any more questions from our viewers? See if we have a couple more coming in here. Sorry, I have to read them as they come.
Well, here, Tina, I'll jump in. I see one here,
Sure.
and it says,
Okay.
if the governor were to lift the public health executive order, would that remove the high risk of no insurance coverage? And it's a great question. And obviously, the current executive order does expire on the 15th of June, and we don't know, no one knows or can predict what will happen after that date. Will he extend the current executive order? Will he reduce certain guidelines? Will he increase certain guidelines? But from an insurance perspective, it doesn't reduce your exposure to an uninsured event. Unfortunately, again, what steps you're taking as a community to help reduce risk is there to help defend you in the event of a bodily injury claim that's brought against you that you're having to defend yourself.
Mm-hmm.
So regardless of what the executive order states, yes, whatever it is, we want to make sure that we're following it as closely as possible, because you may or may not be in a position where you're being expected or financially required to defend your own association. So I hope that answers the question.
Yeah, it's great. I do have a question here. I think I would direct this to Kevin as the legal advice, and I'm not quite sure. It's a little bit vague. Are pool monitors required? I've asked back to the person asking this if they're talking about lifeguards.
I think I understand what they're talking about.
Okay.
It's a good question and something I should have touched on. You know, like Clay said, the governor's order expires on the 15th, and the governor's order right now is requiring all non-critical nonprofit corporations to do certain things. So community association would fall under that, and there are certain things such as enhanced cleaning, social distancing within that order that need to be followed at an amenity area. So right now, there's an argument that they're required. Once it's lifted, again, it may not be required, but there's still probably an obligation to do these things to mitigate potential risk, especially if there's no insurance. But as far as the pool monitor, I'm telling my clients that I think they need to have them. And it's probably not a good idea to have volunteers from the community doing it. You probably need to have your pool company or a third-party security company be able to put someone at the pool, make sure that the rules, the additional rules that the association has put in place are being enforced. Because at the end of the day, if the association gets sued, it wants to be able to prove or at least demonstrate that it did everything possible, and the likelihood that the person who got sick didn't get sick at the amenity area, because the amenities had all these rules in place and the association was enforcing all these guidelines. So, you know, again, we might have to pay for that defense. That's the ultimate risk. But again, if we have the best defense possible and we have a monitor that can testify that, you know, he or she was there, he or she was enforcing these things, that's going to put the association in the best position possible to defend against one of these claims in the event of something.
Excellent, excellent.
I just wanted to add really quickly, Tina, that the governor's executive orders also mention that lifeguards cannot serve as monitors and vice versa.
Oh, okay.
So that lifeguards are there for life-saving resources, and monitors are there simply to help enforce social distancing, cleansing, sanitizing, so on and so forth. But and I know there's I think Craig Sears might be on the call. He might be able to weigh in on that through chat, but that's my understanding.
Yeah, I was just going to mention that, you know, we have some excellent pool service companies in our membership. So certainly look at that. If you do not have a pool service or you're looking for a pool service, I recommend any of those in our membership. I have another question for Kelly. Somebody is asking what the name of that COVID device was that you showed us, the key.
It's called the COVID key.
The COVID key.
It
Simple
looks
enough.
very much like a key. So you
Simple
put it
enough.
up. Yeah.
Awesome. Well, we are coming to the end of our, that's so cute. We are coming to the end of our time today. I want to thank all of our panelists. These are the experts. Those of you, definitely reach out to them. They're there for you. They're great resources, and they can really help you out if you're looking for any of these folks for some work to be done in your neighborhoods or in your communities, or you need some advice from them, they are the experts. So in respect of everyone's time, we wanted to make sure that we ended by 12:30. We appreciate you joining us today. Again, a big thank you to our panelists. I want to encourage you to attend the rest of the webinars. We have one on Thursday from 11:30 to 12:30. That one is on community association regulation, the gray areas. We do have some different business partners on there, as well as a state of the chapter address from our president, Mike Crew. And we encourage you to send this out to your clients, coworkers, homeowner leaders. It is open to anyone to join. So I hope everyone stays well and stays safe. And if you have any questions or need any information, you can certainly contact me at, you have my address, but it's executive director at CAI-Georgia.org, and I will get you to the right person or help answer your question. Thank you again for participating in today's webinar. This was taped, so we will be able to share it with folks who may have missed it. Thank you, panelists. Have a wonderful week, and we appreciate you.
Thank you.
Take care.
Thank you.
Thank you.